Okay. Nice meeting you all. It's my pleasure to be with you here. I'm Zeinab Khadr, and my co-author is Dr. Omnia Mohsen. Let me introduce Dr. Omnia Mohsen because she's the one that hasn't been introduced. Dr. Omnia Mohsen is a medical anthropologist. She has an extended work on the side that I don't excel in it, which is anthropology. I'm a statistician by training. I am a demographer by PhD and research, and I work on social aspects. Today we're going to talk about something that has been all these previous sessions has been focusing on those people. It's how to support those people. So we're going to talk about daughters. I'm just waiting for the presentation to show up. Daughters' care burden for older mothers with Alzheimer. Everybody, starting from the first day, we have been talking about programs, how to develop policies, how to initiate and how to create healthcare service, how to create carer, or how to support carer. Now we're going to talk about reality. What's on the ground, okay? So to start, we're going to talk about introduction, and our introduction is going to say why women and daughters. Why you care about women, especially and daughters. And I'm going to focus on Egypt. I'm not going to talk about the MENA region. I'm not going to talk about Arab region. We're talking about Egypt and numbers of Egypt. And we're going to move into the qualitative study and finally the recommendations and conclusion recommendation. Generally speaking, if I'm talking about why women and daughters, we have to think about three different reasons, or group of reasons for that focus. The first one is demographic, the second one is dementia related, and the other one is caregiving related. For the demographics, I'm going to say that in 2024, according to the United Nations numbering, we are 114 million persons in Egypt. There is 9.2 million of persons, or 9.2 million persons aged 60 and above, and they accounted for 8%. Women, they account for the majority, it's 55.8%. 39% or 40% of them are, not married, it's currently not married. They are widows or divorced. Most likely they are, my mistake. 40% are married compared to men. We have 86%. So they are, the majority of them are widows. More than half of them, they have never attended school. Compared to men, it's 35%. They are housewives, the majority of them. They worked previously. And compared to men, which is 95% who are currently working or worked before. 72%, according to some pilot survey that we have done, are suffering from chronic health problems compared to 65.2% of men. So women are illiterate, they are alone, they are not working, so they are relying on other people for their support. They are suffering from chronic disease. Please remember these because we're going to need them when we talk about dementia. In 2050, the situation is not going to change a lot. We're still going to be the most populous country in the Arab country. We're going to have 23 million people aged 60 and above. 55 or 54% of them is going to be women. We're going to have, we're going to have 2.5 2.5 million persons who are aged 80 and older, and among them we have 64% of them are women. There is something called succession, in which you try to interpolate some of the fixed characteristics of the older population. And I did this interpolation and succession, and I discovered that there is 32% of those women will be uneducated by 2050. And we're going to have 77.8% of those women still housewives. Okay? Let's talk about dementia. Dementia globally is a very disease that hasn't been resolved medically yet. So we still have 55 million people worldwide affected by dementia. 60% of them reside in low and middle income countries. Annually, there is 10 million cases added to the dementia. Dementia arises from various diseases and injuries that impact the brain. Alzheimer is a major contributor. Dementia is ranked among the 7 leading causes of death globally. In Egypt, we don't have a prevalence for dementia. Thank God that we're going to have the HCAB helping us in that. However, there is a few studies that has been done, and there was a good systematic review of these studies, and they indicated that dementia in Egypt ranged between 2% to 5%. They also indicated that dementia increases with age and rapidly increase among those aged 80 and above. Prevalence in dementia is higher among women, particularly those in age 80 and above, and it reached about 50%. Prevalence is positively related to illiteracy, suffering from chronic disease, and low socioeconomic status. According to the international literature, low socioeconomic status increased the odds 5 times. So if we try to tie between this and the characteristic of our older women, you'll find that our older women are very vulnerable to the dementia. Okay, for caregiving, there is this nice chart in which we say that we have long care and we have short care. Term, there is the daycare facilities for the short term. For the long term, we have the hospice, we have the nursing home, and we have the home-based. For our culture, hospice is not that widespread. Nursing home culturally is not acceptable, although there is a promotion for nursing home, although I'm one of the persons who's totally against it. It's being within the family and aging in place. This is what the WHO have been calling for. For the home base, we have the formal, which include the skilled helper. And for the informal, we have the unskilled helper and the family caregiver. Okay, for the skilled helper, I think Dr. Yasser has mentioned that we have aged care program in Egypt that started in 2018 by the Ministry of Social Solidarity and the collaboration with the National Institute of Longevity and Elderly Studies. And they are training people on organizing entertainment activities, in preparing nutritious food, providing healthcare services, including monitoring general health status, in particular the chronic disease, availing the medical instrument needed, provide personal care and household maintenance, caring for the incapacitated and bedridden older adults, and caring for people with dementia, Alzheimer, and other hallucination-related disease. For the unskilled helper, we have a problem. These are most likely the domestic workers, and those are totally unskilled. They don't know how to deal with the aged person. And on the other hand, the aged person themselves, they don't trust them. They have some psychological obstacle of them helping them. So they usually fired. And I have an example of that. Family caregiving, we are a collectivism culture in which familism and filial piety are the main core ethical culture values in our life. So everybody has to care for the family member. The task is usually shouldered by women. According to a study that I conducted a long time ago, if you don't have a male son, it takes you 3 daughters in order to compensate for the economic support of the son. If you don't have a daughter, it takes about 7 sons to compensate for the absence of the daughter. So this is a major one. And adding to that, the personal nature of help wanted, it's not the daughter-in-law, it's the daughter. So it has to be the daughter. Okay, so the objective of our study, it was qualitative. So I apologize, I'm a statistician, so most likely my input in this part is related to what Dr. Omnia has provided me. The objective is to give voice to the daughter caregiver and to let them put their condition on the table and discuss it from the perspective of their own. Our methodology was qualitative, and I have to stop here and say that I am totally acknowledging the bravery of the women that has worked with us, has been interviewed in this study. When we started, it was Dr. Omnia promised, okay, I have 5 cases secured. And I told her, I'm a statistician, no, at least 30. And she said, okay, I'll try to find 30. And we went to the 30, and the majority of them declined. They felt it's shameful to put their pain on record or some sort of a paper. So those 3 women has been very, very brave in talking about their condition. We had other cases, but I declined them because they are not representing what we call it the normal case. Okay? Let me introduce our women. We have 3 different cases of women. We have a resident one and 2 non-resident. The 2 non-resident, they are different in the fact that one of them is a housewife and the other one is working. So we have Saida. These are fabricated names, and we call her Saida because we elected her as the most adaptable one for the cases of her mother. She is Saida, but she's not. Saida is a widow. She's university educated, currently working, has 3 brothers, 2 daughters, and 1 son. She's an upper middle class. She resides with her mother ever since she became a widow, and her relationship with her mother has been strong, and it became stronger as they lived together. Her mother is 75 years of age and diagnosed with mild Alzheimer 2 years ago from the interview. But according to her view, her mother's condition has been progressing very rapidly. Our second case is Miss Ihsan. Miss Ihsan, she's a housewife, but she has daughters in school age. She's married. She lives in the same neighborhood, so commuting from her mother to her house is not such a long commute. She's a university educated. Her mother went into an emotional turbulence because of the death of her father. So, and this is one of the contributing factors for being exposed to the Alzheimer. Her mother was offered to live with her in her house. Her mother insisted to live in her own house. On the other hand, daughters of the caregiver was upset because the grandmother will take one of the rooms and this will sacrifice their independence. And our final case is Samah. She's 53 years old. She's a non-resident caregiver. She lives about 45 minutes away from her mother. She has a husband, she has daughters, she has her father co-residing with her mother. She has her brother and her sister-in-law co-residing with her mother. However, she was elected by the whole family to take care of her mother. Her mother was diagnosed with Alzheimer, but she has a heavy loaded history of disease, medical disease, including stroke, hypertension, diabetes, osteoporosis, and you can mention other things. Okay. From the WHO definition, I'm going to present the definition of the WHO of the symptoms. It's changes in the mood and behavior may occur even before a memory problem manifests itself. Feeling anxious, personality change, inappropriate behavior, withdrawal from work and social activities, being less interested in people. Early signs: forgetting recent things, misplacing stuff, getting lost in familiar places, difficulty solving problem, trouble following conversation, challenges performing familiar tasks, and misjudging distance visually. From our interview, this is the perspective of our caregiver. The most difficult thing for the caregiver is the incomprehensibility feeling of these transformations. They cannot grasp these transformations. And the instability and the rapid progress of these transformations. Sometimes the mother is in a good mood, sometimes the mother in a bad mood. And there is no sign to tell you which mood she is in. She's totally transforming in a second. Dementia and Alzheimer are transformative disease that starts with the simple symptoms and usually confused with old age. All these three cases, they said that we thought it's my mother, it's old age. It's very common that she can forget. However, and we're talking about old age, and we're talking about memory loss and all the related. Not me. It's not me. Okay. All the related anger and anxiety that comes with the memory loss. I forgot to put where I put my keys. I forgot where I put my shawl, whatever it is. But it progresses rapidly into incapacity in physical status, slow movement, inability for personal care, visual distraction. Mental health status, loss of interest, mood swings, isolation, and I'm insisting on bolding this, attachment to the caregiver. And all things. Attachment to the caregiver, they identify the caregiver as their sole window to the world. Okay. If we want to talk about the different dimension of the caregiver, we have to talk about, first of all, interaction with the health system. We have to talk about the changes that they have to do in the physical environment at home. We have to talk about family dynamics. We have to talk about social network, economic conditions, physical conditions, and psychological conditions. All of these are very important dimensions in the life of the caregiver. For the first one, interaction with the healthcare system. The interaction with the healthcare system, where we realized that we have a problem with our mother and we have to go to the doctor. And the healthcare system was mainly focusing on the medical part of it. Your mother has an Alzheimer. First stage, middle stage, whatever it is. They never talk about how the disease is going to progress. They never talk about how I'm going to take care of my mother. And we can see it in their quotation. His recommendation was to try to keep my mother's condition stable. How? And only gave us very general instructions. They were very useless. For Ihsan, I did not find any psychological support for me or a training center on how to deal with the situation. Actually, for Ihsan, there was another thing. The doctor was very frank when he diagnosed her mother. And he said that, Miss Ihsan, mother, you have a dementia. And the woman, in the second, linked all this information that she got from the doctor with the horrific information that she knows from the movie, and she went into a long episode of cry and depression for a very long time. For the Samah, we had the doctor telling them, your mother is in the second stage of dementia, and there is no cure for it, and you have to smile all the time. And this was his instruction, which is, wow, thank you. Give me information. Something like when you hear the woman say, when my mother started to have urine incompetency, come on, nobody told you that she's going to suffer from that? No. When my mother was falling because things in front of her, nobody told you that? No. So they focused on the medical diagnosis of the disease, not the health and welfare. If we're talking about formal caregiver, thank you. Everybody has mentioned that we don't have it in Egypt. And I tried to hire a nurse, but my mother didn't trust her. My mother, in her hallucination, she always accused people of stealing from her and trying to kill her. It's so difficult to find the qualified care. When I have to run some errands, I have to ask my sister-in-law to take care of my mother. And let me add to this, when I come back, I am faced with an angry face for 3 or 4 days for leaving me with a stranger. So the attachment of the caregiver is being imposed all the time. Okay, physical environment. Nobody told those 3 women anything about what's going to face them. Physical environment has to be totally changed within the household. In Egypt, we have ceramic floor, which is one of those common floors that we use. These are slippery. These women have to change the ceramic slippery floors into harsh floors in order to prevent their mother from falling. Locks is a very common tool around the house. Locks are being put all over the place, on the windows, on the doors, on the bathroom locker, on the kitchen cupboard. Locks are all there. Samiha, which is the one who's living 45 minutes ago, her mother tried to wander outside the house. She found a lock, and she decided that she's going to go out through the balcony. So she had to put iron gate on the balcony and the door. All the carpets has to be removed. All the curtains and sheets has to be removed because Samiha's mother, when she is in her upset situation, she starts tearing them. All the mirrors are being removed or covered. all pictures of the family has to be covered because they ignite sadness in those women, and this will worsen their situation. Ihsan, she's an upper middle class, and she tried to find a solution for herself. She put surveillance camera in her mother's household. She was so clever, but her mother, in her stable way, she cut off all the wire of the camera because she told her, these camera prevent you from coming and seeing me and staying with me. She disconnected the internet because Ihsan wouldn't be able to connect her, and she stayed at home, and she had terrible situation of not talking to anybody and leaving food on the floor, and they had some sort of insect infestation in the house. Family dynamics. Actually, we are a very tightly knit family connection. However, when things get for a very long time, I'm sorry, I'm depressing you. I'm depressing everybody. I have been depressed for ages. But when things, extended for a very long time, everybody goes about his own business. So family dynamics is very supportive at the beginning. Everybody is, up to it and will helping you. Husbands are there, friends and family are there. And after a while, it dwindled down and nobody is there. For the resident one, which is Saida, she said that she was, meeting a lot of friends and family coming to the household, and her grandchildren would come, but she started to impose some rules. No loud voices, not coming without your parent. So they withdrew and they never showed again. Saida was a clever one. She noticed that everybody wants to visit her mom. Her mom seemed to have a very wide social network. However, she was upset to the fact that they are coming at all the time. She cannot cope with the housework and taking care of the guests. So she created a WhatsApp group and invited people to come when her mother is feeling good, which is a very clever one. That's why we appreciate Saida and we call her Saida. Saida complained that she cannot complete a whole phone call with her daughter because she's always required to do something else for her mother. Ihsan, when her husband was very supportive in the beginning. However, by time he started feeling that this is coming over the account of his daughters, and he started taking care of his daughters, which is very good. However, she felt isolated. She cannot be separated from her daughter. And she starts saying, okay, when I go home, they start complaining about my absence and my neglect to them, so I'm not good, I don't know what to do. Samah, her husband threatened that he's going to take another wife. He gave up. That's it. It's not working for him, although she tries to have one meal with him every day. She tries as much as she can. But he said, no, I'm getting another wife. Social network, as I mentioned, they are very supportive. However, sometimes they are pressuring people. It's a double edge because some people don't know what's the meaning of Alzheimer. So we hear something like Saida. I would hear harsh words like, when your mother in such condition, don't show her off. Better keep her at home and no need for scandals. Social network is a positive thing. Something like Ihsan, she said that we visit our relative and friends in the village. They live in the city, so they went to the village. Her mother's condition was getting better, but she cannot live in the village. For Samah, she said, all my friends and colleagues, they forgot about me. Nobody remembers me. I only hear about their good news through the social media. What do you think? economic conditions. Most likely, all the studies has been focusing on the cost of labor. 1 hour of labor costs 10 pounds, so 10 hours of labor, it's 100 pounds. However, there is an economic cost that has been endured by those women. Large amount of purchases when with the Alzheimer starts, mothers take control of their Visa card and they start buying like crazy from the internet things that they don't need it. For Ihsan, installing the surveillance and fixing it all the time. Household alteration, it needs to be, it's costly. Adding to that, the destructive things, mother, when she gets very upset, she is tearing everything. So, for Saida, she said that she began to buy things that we don't need from the street vendors, from sales representative, electronic sales sites, using a phone, and I had been into a financial crisis because of this. And for Samiha, my mother would throw the food on the floor. It's not only the cost of the food, but it's also the physical effort of cleaning after that. For Ihsan, she said the same thing about buying stuff, and she said that she tries to hide the Visa card from her mother, but her mother, when she's in a stable condition, she will ask for the Visa card again. Physical strain, it's working all the time, 24 hours for the mother. And in the cases of non-resident, they have to keep the 2 households. They don't know how to deal with the situations of caring of the mother. So she throws her entire weight on my back, causing tear in my ligament in my shoulder, or at least, in some cases, hand or arm twist, or a muscle strain in my back. They can barely sleep. Ihsan said, when I sleep with my mom, I can barely shut my eyes because I know that she's going to wake up and wander in the street, in the household, and I need to be sure that I'm there. For Samiha, it was all the time, are you going to go to sleep? Wake up with me. And for Samiha, there is one instance in which the doctor has, she was complaining that she cannot sleep, and he said, okay, occasionally you can use sedative medication to make her sleep. Her mother started taking this, and she slept all morning, and she wakes up all night. So Samiha decided to keep her awake all morning and try to sleep together in the middle of the night. Psychological strain. Those women, they end up under substantial mental, psychological pressure, feeling lost, frustrated, overexhausted, filled with guilt, and totally social isolated. The mothers, when they are angry, some of them would insult the daughter, scold her, regardless who's there. And we have Ihsan saying that I have been hit on the face by my mother in front of my daughters. I felt so embarrassed, I couldn't talk to my daughter after that. And they are really under a great pressure. These are just a small quotations, but they are really expressing, I'm almost clinically dead. Everyone is upset with me. My daughter is upset, my grandchildren is upset. I don't know anything about they don't know me anymore. I'm a living dead person. For Ihsan, my children and marriage is on one side, and my mother is on the other side, and they are competing on me, and I'm frustrated. I cannot deal with that. For Samah, she said, I am the one who is sick, not my mother. When does this day end so I can get some sleep? So, in conclusion, there is a substantial lack of information about the disease and its progress. Nobody knows anything, not the public, not the caregiver, nothing. We don't know it until we have it. There is substantial lack of qualified physicians, skilled caregiver, and support group. Caregiver learn from experience. When my mother fall, I'll learn that I have to get rid of the carpet. When my mother goes through the balcony, I have to put the gate. Caregiving has significant implication for the caregiver's social, practical, physical, and mental well-being. Actually, for those women who are working, they were complaining that although their colleagues at work appreciate what they are going through, they still feel that they have been put aside in their work and there is no achievement on their work. The cost of caregiving needs to be more comprehensive and exceed the current approach of labor and medication cost. Okay, so what's our recommendation? I was so puzzled to say what's my recommendation, and I stayed for 2 days trying to write my recommendation. Caregivers needs at the moment that the mother has been diagnosed to be fully and comprehensively receive education about the dementia, including its progress over time and different stages. They have to know. Training on management of all care dimensions for the older persons. Information on managing stress, how to work with stress and caregiving and preventing burnout. We have heard about a lot of service that's being provided, but it's very limited. We need a whole map of what kind of support services are there in the community, not in the governorate. I live in Tagamma, I need to know what's in Tagamma, okay? General public, they have to receive information on the disease, its risk factors, prevention, and early signs. First of all, so they would appreciate what the caregiver and the demonic person is going through, and no harsh words. They have to prevent it. One of the main factors of dementia and Alzheimer is social isolation. And we were hearing about connection. Social isolation, leaving the person for his grief after the death of the husband, partner, son, whatever it is. And how to deal with it. And early signs, we have to detect it in order to be able to cope with it and work with it. Sure, we need to increase the healthcare labor force in geriatric and dementia care with culture-sensitive training. We have to tell the doctor that, yes, you're a doctor 100%. However, you are a hakim, which means that you have to be wise in telling the information to the people and to have the whole package that we mentioned in the beginning for the caregiver at hand. Once you diagnose, you say, okay, I have a whole package for you that you can rely on it. Create a cadre of skilled caregiver and promote their existence because we don't rely on them. We still have this culture apprehension against anybody taking care of our aged person. Develop initiatives and interventions supporting caregiving that are culturally sensitive. And finally, support research and studies on the social aspects, social, not the medical. Medical, they are doing such a great job. They are trying to cure the disease. And caregiving burden to set the recommendation for the well-being of patients and their caregiver. Thank you very much. and I appreciate that.